Assalamu alaikum everyone. I hope everyone is staying home and safe in this pandemic. Well, first let me introduce myself. This is Kazi Amit Hasan, a student of Department of Computer Science and Engineering at Rajshahi University of Engineering and Technology, presenting our research paper titled Identification and Analysis of Risk Factors of Lower Back Pain using Machine Learning Approaches. And my co-author is Mohammad Al-Mehedi Hasan, Professor of Department of Computer Science and Engineering, Rajshahi University of Engineering and Technology. And our paper ID is 716. Moving on. Well, these are the outlines that I'm going to discuss in my whole presentation. Well, if I divide my title, then we will get four keywords. First one is identification and analysis, then the risk factors, then the lower back pain or LBP, and then the machine learning approaches. I'm going to discuss about this in my whole presentation. Moving on. Now the motivation part. Well, motivation means what drives us to work in this field. Well, lower back pain is most rapidly growing complication worldwide. It affects productivity and performance. About 150 million workdays were lost per year because of lower back pain, and people ranging for 35 to 55 are at high risk of lower back pain. Just in United States, about 31 million individuals experience it at any stage. And this increasing number of affecting people also increases the medical treatment cost, which is around 50 billion each year. On the right side, you can see the age group that are affecting with lower back pain each year. And as you can see that from 5 years to 80 years, every span of people are affecting with it. Moving on. Now, the problem statement and the objective. Well, most of the data set are affected with outliers, and most of the works are lack of risk estimation part. And the whole analysis part is very required with high cost and need experienced manpower. So the objective of our research is to develop a system that can classify the patients effectively, and we want to reduce the clinical cost, and we want to introduce the risk estimation part, and we also want to diagnose the patients in early stages before turning it into a chronic stage, and we overall want to reduce the mortality rate. Moving on. Well, these are some previous works that have been done in this field. Now, our contribution part. Well, in this paper, we have identified the outliers and handled them. We have introduced the risk estimation and analysis part, and we have also improved the results and the overall predictive results. Moving on. Well, this is the overall workflow of our method. As you can see that first we took the data, and in the data preprocessing part, we have used the outlier identification and handling. And next, we have two type of methodologies. First one is the statistical logistic regression analysis variance, which works for our risk estimation part. And the next one is predictive analysis. Moving on. Well, now the data set. Well, these are some key points about our data set. The data set was collected from Kaggle, and this also using several researchers. And there are 310 number of responses and 12 attributes. On the right side, you can see the attributes name and the labels of our data. Moving on. In the data preprocessing part, we have identified that there are several outliers in our data. So we have to handle them. Because the outlier can affect the statistical decision making significantly, it also can influence the model performance. Well, so in order to remove the outliers or handle them, we have used the interquartile range method. And after implementing it, about 6 features were having outlier. So as we are working with 12 features, so rather than completely removing them, we replace the extreme values with the median values. Moving on. And this is a visual representation, and the left side image is before handling the outlier, and the right side image is after handling the outliers. Moving on. Now the risk factor identification analysis part. Well, in this case, we have used the two-step validation. First, we have used the analysis of variance. Then we have used the statistical logistic regression. Then we combine the output and validate the outputs with the ground truth. And finally, we got our final risk analysis. Moving on. Well, these are the evaluation metrics that we have used for our Risk factor estimation part. Well, so the potential risk factors were identified with logistic regression and ANOVA methods. On the right side, you can see the F score and the features. The high F score is representing the high risk factor. As a result, degree, spondylolisthesis, pelvic incident, pelvic radius, lumbar lordosis angle, and pelvic tilt are attributes that are found as significant risk factor associated with lower back pain. Moving on. And this is the F scores before and after handling the outlier. The left side image is the F scores before handling the outlier, and the right side image is the after handling the outlier. As you can see that there is a significant change in F score and order after handling the outliers. Moving on. Now, the second part, we have used the stats model tool to measure and identify the relative risk factors. So we have used the odd ratio in this case. According to the table, the pelvic incident, pelvic tilt, lumbar lordosis angle, pelvic radius are the most significant risk factors. And these results validates the outcomes with the ground truth. Moving on. Now the predictive analysis part. Well, the whole dataset was split as 80:20 in the train and test part. The performances were evaluated before and after handling the outliers. The best results were achieved with k-nearest neighbor algorithm, and where we took the value k equal to 20 in the after handling the outlier case. KNN achieved 0.92 accuracy with our proposed method. We are going to discuss about it in the resulted part more. Moving on. This is the evaluation metrics for our predictive analysis. And well, these are the results and performance part. Well, as you can see that after handling the outliers, our performance were improved significantly. As you can see that the accuracy, precision, recall, F1 and AOC, all scores are significantly higher in the after handling the outlier stage. Moving on. And this is the comparison of our proposed method with other state-of-the-art methods. As you can see that with our proposed method, it's basically outperformed every accuracy score in all cases in terms of accuracy, precision, F1 and AOC. Moving on. The future scope. Well, we want to apply our process on more dataset and diseases, and we want to establish a web server that can assist the specialist. And the conclusion, we want to say that we want to propose a system that can distinguish the patients effectively, and it can assist the specialist to determine the appropriate treatment. And we want to reduce the clinical complications along with lower back pain. Moving on. These are the references that I have been used in this whole presentation. Well, thank you everyone. Any kind of questions are welcome.